Do I have cancer? A Screening and Detection Guide. Chapter 1. Do I have cancer? A summary of Ezra.com/do-I-have-cancer. Several factors could cause DNA mutations, including radiation such as X-rays, radioactivity, UVs, chemicals, benzene, beryllium, asbestos, vinyl chloride, and arsenic. Viruses like papillomavirus, HPV. We all have mutated cells that could become cancer at some point in our life, but our immune system does a good job fighting them. Some of us inherit genes, like BRCA mutations in breast or ovarian cancer. Prevent cancer. Get physical exercise. Eat a balanced diet. Quit smoking. Be proactive and screen for cancer. Early signs of cancer. Difficulty breathing. Abnormal pain that's not going away. Persistent swelling. Unusual and recurrent coughing. Hoarseness. Shortness of breath. Appearance of breast lumps. Inflated lymph nodes under your armpit. Lumps on testicles. Changes in bowel habits. Constipation. Indigestion. Unexplained weight loss. Back pain. Belly pain. Bloating. Troubles of urination. Skin darkening, irregularly shaped moles and warts. Itching. Unusual bleeding. Skin yellowing, or jaundice. Postmenopause vaginal bleeding. Growing tumor on the ovaries. Pelvic pain. Night sweats. Signs of cancer at cancer.org/treatment/understanding-your-signs-and-symptoms-of-cancer.html. Cancer Helpline. 800-227-2345. Fever. Bleeding. Pain. Fatigue. Extreme tiredness. Weight loss. Normal lymph nodes are tiny. When there's infection, the nodes get larger. Fatigue that doesn't get better with rest. Weight loss or gain of 10 pounds or more for no known reason. Eating problems, not feeling hungry. Trouble swallowing. Belly pain. Nausea and vomiting. Thickening or lump in the breast. Pain, new or with no known reason that doesn't go away or gets worse. Skin lump that bleeds or turns scaly. A new mole. Sore that does not heal. Yellowish color to the skin or eyes, jaundice. Cough that does not go away. Unusual bleeding or bruising for no reason. Change in bowel habits. Constipation. Diarrhea. Bladder changes. Pain when passing urine. Blood in the urine. Needing to pass urine more or less often. Fever or night sweats. Headaches. Vision or hearing problems. Mouth changes such as sores. Bleeding. Pain. Numbness. A brief cancer quiz at quotev.com/quiz/424746/will-u-get-cancer. There are tests for different types of cancer. D-zone is for kidney cancer. Have you ever been diagnosed with cancer except for non-melanoma skin cancer? Are you male or female? How old are you? Has your biological family member ever had kidney cancer? How tall are you? How much do you weigh? Chapter 2. A Cancer Detection Guide. How to detect cancer early. Don't mess around with your health. The average guy and many women are the exact opposite of a hypochondriac. They won't go to a doctor unless they can't move. If you start to feel really tired and it doesn't go away, it could be cancer. If you get a cold and stays for over 2 weeks, it could be cancer. Abnormal prolonged pain could be cancer. Overall, all of a sudden you're out of breath, you can't walk more than 100 feet without feeling weak, then common sense says go to an emergency room, tell them you think got some disease because you're so tired. There's no one universal test to detect cancer, but a routine blood test to look for carcinoembryonic antigen is used to look for colon, pancreatic, lung, breast and prostate cancer. Get routine checkups. Get diagnostic tests. Get a periodic mammography and for men, a PSA for the prostate gland. Get pap smear tests. Get a colonoscopy and other tests. Be health conscious. Do not ignore any sign or symptom that seems drastic and painful. Cancer can build up and you can feel fine until it hits you real hard all of a sudden, like shortness of breath. If there's anything alarming, speak to your doctor immediately. Notice abnormal signs affecting your body like pain that lingers for a long time, swallowing difficulty, enlarged lymph nodes or swelling over a part of the body, indigestion, either constipation or loose stools, sores in the mouth, fatigue. Go to a doctor. Live healthy all the time anyway. Lots of people die because they don't get cancer treatment early. Detect breast cancer. Breast cancer symptoms are usually detectable because of symptoms like lumps, nipple discharge, and changes in the shape of the breast. Women should perform a breast self-exam every month as a way to check for changes in their breasts that may be signs of breast cancer. Look at your breasts. Has their size, shape, or texture changed since your last breast exam? If something is noticeably different, see a doctor to get it checked out. Feel your breasts for lumps or a thickening of the breast tissue. Use the fingers of one hand to feel the opposite breast, with the close hand behind your head. Put your fingers in a circle. Press and then turn a bit to feel for lumps. Cover all areas. Go right up to the underarm. Squeeze each nipple to check for discharge. There shouldn't be any. Try the breast exam both lying down and standing up. If you do find a lump or a change in your breast, go to a doctor. In addition to the manual breast exam, women over age 45 should get a mammogram every year or two. A mammogram is an X-ray of the breast that shows lumps. If a lump is found, then you go to a doctor who takes a little bit of it out, called a biopsy, and does a test to determine if it's cancerous. If a woman has a cancerous breast lump, there are a variety of treatments like chemotherapy, radiation, lumpectomy, surgical removal of the lump and surrounding cells, or a mastectomy, surgical removal of the entire breast. Some studies have concluded that use of birth control pills could increase the chances of getting breast cancer. The American Cancer Society provides free materials on breast self-examination. The general procedure is to look at your breasts in a mirror while standing up, arms outstretched, then at the sides. Next, laying down, start at the outer end of each breast, move in 1 inch with each circular motion, feeling for lumps or any abnormalities. Squeeze the nipple to see if there's any discharge. People die from breast cancer. If there are any irregularities, go to a doctor immediately. The classification procedure is 3-pronged, called TNM. Tumor size. Node involvement. Metastasis. Ask your doctor about your status. Many people survive breast cancer, so don't despair. Many lumps in the breasts are harmless/benign. They may be enlarged lymph nodes or cysts, lumps of fluid, which are not cancerous. A fibroadenoma is a common, benign lump of connective tissue. Don't immediately panic when you feel lumps. Get a mammography. Detect bone cancer. Bone cancer is often detected when a bone breaks without an obvious cause. You might feel pain in the afflicted bone. There are bone scans, X-rays and blood tests to detect bone cancer. If a tumor is found, tests are done to determine whether it is benign or malignant. Some imaging tests are radionuclide scanning. A radioactive substance is injected into the bloodstream to produce images that show where the cancer is growing. Computed tomography, CT, scanning. Magnetic resonance imaging/MRI. Angiography, X-rays of the blood vessels taken after a special dye is injected into the bloodstream. Detect colon cancer. The most common screening test to detect colon cancer is the fecal occult blood test, which checks for traces of blood in samples of stool. A more accurate test is called a flexible sigmoidoscopy, a visual examination of the lower third of the colon and rectum that uses a probe with a light and a camera attached. The doctor looks through the viewing tube to check for polyps or signs of cancer. A colonoscopy is a similar procedure that examines the entire length of the colon. The doctor may remove tissue for a biopsy during the test. Another test is a barium enema. Contrast medium, a dye, is inserted through the rectum into the colon and X-rays are taken of the colon to look for abnormalities. Detect lung cancer. The first diagnosis in lung cancer is often through a chest X-ray. Standard chest X-rays may not pinpoint the existence of cancerous cells in your lungs. Doctors might advise a CT scan of the chest, brain, and abdomen to detect the presence of any tumor. Magnetic resonance imaging, MRI, scans help to indicate the exact location of any tumor. MRI scans use radio waves, magnetism, and computer enhancement to produce body images. Positron emission tomography, PET, scans can detect metabolic activity and functioning of tissue within the lungs. Sputum cytology is another simple diagnostic procedure to detect the presence of a tumor. Detect pancreatic cancer. Cancer of the pancreas is often not detected until the later stages when the cancer has already spread outside the pancreas. Symptoms are a feeling of pain or pressure in the upper abdomen, nausea, loss of appetite, weight loss, weakness. If the tumor blocks the duct through which bile passes into the small intestine, the person develops jaundice, which is a yellowing of the skin and the whites of the eyes. The urine probably becomes dark. A CT scan can detect tumors on the pancreas and see whether they have spread to other nearby organs like the liver, lymph nodes, and stomach. Ultrasound and MRIs can do the same thing. If you develop jaundice, an endoscopic retrograde cholangiopancreatogram/ERCP can detect irregularities in the bile ducts. There is no specific blood test, but a substance in the body CA19-9 is consistent with pancreatic cancer. Biopsies of the pancreas gland are also done. In a needle biopsy, the doctor inserts a long needle into the abdomen and then into the pancreas to obtain a tissue sample. A brush biopsy is performed along with an ERCP. The endoscope rubs off some cells with a brush attachment. A laparoscope can also be used to get a tissue sample. Detect skin cancer. The rules for detecting melanoma are to look for an asymmetric mole with an irregular border, uneven color, and a diameter that seems to be getting bigger with time. Use mirrors to check your backside or get a friend to do it. Have follow-up check UPS with your doctor. UnitingAgainstLungCancer.org, Uniting Against Lung Cancer, supporting the search for a cure and identifying and advancing research, education, and early detection initiatives. Chapter 3. Cancer Imaging and Screening. Cancer Imaging Techniques. Through imaging techniques, doctors can get a detailed picture of what is going on without making any incisions. The various imaging techniques include 1. X-rays. X-rays are a type of electromagnetic radiation that helps us get a clear picture of the inside of our body. The dense structures of our body, such as cartilage and bones, easily absorb these electromagnetic rays, but lighter substances, for example, blood, do not absorb them. So, any form of abnormal growth or cancer should appear as a shadow on the photograph. A mammogram is a form of an X-ray and is the basis of screening for breast cancer. 2. CT scans. A CT scan or CAT scan takes various X-ray photos from various angles of the body and then compiles them together, through a powerful computer and 3D imaging programs. The slices, showing cross-sections of the patient's body, help the doctor to locate exactly where any tumor is. A CT scan can be a great help in planning radiotherapy or surgery. 3. MRI scans. MRI or magnetic resonance imaging uses magnetism to form a picture of the inside of your body. The body is exposed to a magnetic force that is 20,000 plus times stronger than the Earth's magnetic field. The body responds by vibrating slightly to release radio waves, which the scanner captures. The waves are analyzed to form a picture of the inside of your body. It gives doctors a more detailed view than an X-ray. Therefore, doctors use them for head and brain examination and for measuring blood flow. For PET scans, PET or positron emission tomography is a recently developed technology, in which tiny tracers are injected in the patient. These tracers release positrons, a subatomic particle, which collides with the atoms in your body to release energy in tiny bursts. The scanner picks up these energy bursts and forms a picture of the areas where the tracer has traveled. A PET scan can help medical specialists to find out whether the tissue remaining after treatment of cancer is living or dead tissue. 5. Ultrasound. This scan produces pictures of the inside your body through sound waves. This process involves sending sound waves through small speakers, which rebound off the internal organs. There are microphones that pick up these reflected sound waves and transmit to the computer program, which helps to give an informative image. Endoscopy is a process in which an instrument is used to look into the internal parts of your body to check if there is any problem. This instrument is an endoscope, a thin, long, flexible tube which has a camera and a light on the end. The endoscope is most often inserted in the body through the gullet or anus. Sometimes, the surgeon makes a small incision to insert it. The surgeon can also take samples of any abnormal tissue inside the patient's body. Cancer screening and early detection websites. Cancer screening can help detect cancer at an early stage or even at a precancerous stage, which makes it more likely to be cured. However, screening tests usually involve radiation, which is toxic. Tests may reveal phantom cancers. The doctor sees cancer when there is none. Some doctors might be too quick to recommend cancer screening just to make money. cancer.gov/cancer-topics/pdq/screening/overview/patient, cancer. Screening overview. cancer.gov/cancer-topics/facts/detection/tumor-markers. MeWiney.org. John and Amy MeWiney Cancer Foundation, established to raise money for research, specifically to develop methods for early detection, and to raise consciousness about this disease. Breast Cancer Prevention Partners bcpp.org. Prevent Cancer Foundation preventcancer.org. youtube.com, Cancer Screening Trial. nhs.uk/levual/preventing-cancer/pages/cancer-screening.aspx. NHS Cancer Screening. Siemens.com, Early Detection and Prevention. cancerscreening.nhs.uk, NHS Cancer Screening Programs. cdc.gov/cancer/dcpc/prevention/screening.htm, Cancer Screening. youtube.com, Effective Cancer Screening Tests. ncbi.nlm.nih.gov/pmc/?term=sign Cancer Screening, search PubMed. Central for free access articles about cancer screening. ncbi.nlm.nih.gov/mesh?term=early detection of cancer. Screening.iarc.fr, IARC Screening Group. cancer.gov/cancer-topics/pdq/screening/overview/health professional, Cancer Screening Overview. Cancer Screening at cancer.org. cancer.org/healthy/American-cancer-society-for-the-early-detection-of-cancer.html. cancer.org/cancer/breast-cancer/screening-early-detection-of-breast-cancer-for-the-early-detection-of-cancer-of-early-detection-of-cancer-of-early-detection-of cancer.org/cancer/cervical-cancer-staging/cervical-cancer-screening-guidelines.html. cancer.org/healthy/find-science-rearly/cancer screening guidelines/index, Cancer Screening Guidelines. cancer.org/healthy/find-science-rearly/cancer screening guidelines/chronological-history-of-acs-recommendations, Chronological history of ACS recommendations for the early detection of cancer in asymptomatic people. Cancer.gov/NCI Cancer Bulletin /112712/page 4, Crunching Numbers. What cancer screening statistics really tell us. Chapter 4. A Biopsy Guide. Biopsy Introduction. A biopsy is the process of obtaining the tissue from the suspected cancerous area. A microscopic examination of the tissue or, at times, blood, such as when testing for leukemia, may help to confirm whether it is cancerous. A small piece of tissue is cut with a scalpel or a hollow needle can be used to obtain the sample. The needle finds its way to the suspected area with the help of an ultrasonography or CT scan. Most biopsies are painful. Doctors numb the area by using local anesthetic. Different types of biopsies. 1. Fine needle aspiration. An injection to draw the cells from the tumor or lump in the body. 2. Excisional biopsy. This is the process of removing the entire organ or the lump in the body for testing. Not widely used today, but may be used for breast lumps, spleen and lymphoma tests. 3. Incisional biopsy. For soft tissue tumors, for example fat, connective tissues and muscles. Portion of the tumor is removed to determine whether it is malignant, sarcomas, or benign. 4. Endoscopic biopsy, most common form of biopsy. The endoscope is inserted through the hole in the body or surgical incision. The endoscope is a fiber optic instrument that is flexible and offers visual monitoring of the abnormal area. Forceps are attached to this instrument, which helps in extracting tissue samples. 5. Colposcopic biopsy. A further assessment of the pap smear result. A colposcope provides visual examination of the cervix and helps in removing cells for biopsy. 6. Punch biopsy. A small cutter is used to remove a circular tissue sample. Dermatologists use this process to evaluate skin rashes. 7. Bone marrow biopsy. Similar to fine needle aspiration, but this needle is large and strong because the needle has to pass through bone. Anesthesia is used for this biopsy. Molecular diagnosis. Molecular diagnosis help the specialists determine the presence of cancer with the help of gene chips and mass spectrometry. It studies how the proteins and gene interrelate in the cell. It shows the gene and protein activity on various precancerous and cancerous cell. It monitors changes and the expression patterns. Prostate-specific antigen or PSA is a chemical that normal prostate cells secrete into the bloodstream. However, in prostate cells that have become cancerous, the secretion is abnormally large. It is not always that high PSA is the indication for cancer, because men with high PSA level may not have cancer and some men have prostate cancer but may not have high level of PSA. Generally, molecular diagnostics with techniques such as tissue samples and imaging, specifically contribute towards a diagnosis whether a person has cancer or not. Chapter 5. A mammography/pap smear guide. Mammogram/mammography tests for breast cancer. A mammogram is a safe, low-dose X-ray picture of the breast. A mammogram can find breast cancer that is too small for you, your doctor or nurse to feel during regular physical breast exams. If you find breast cancer early, it is easier to treat. Mammograms work on older, menopausal women better because the breast is fatter then and you can see tumors better than on young women, so mammograms aren't that effective on young women. Feel your breasts yourself and find another method. About half of all new cases of breast cancer are in women aged 65 and older, but 2 out of 3 women aged 65 and older do not get regular mammograms. The risk of getting breast cancer increases as you grow older. Women with dense breasts should ask about getting an ultrasound in addition to the mammogram, which could miss a tumor if there is one. Cancer can show up at any time, so one mammogram is not enough. A screening mammogram is done when you and your doctor think your breasts are completely healthy. It is important to return for a screening mammogram every 2 years if you are 65 or older. If you find a lump or see other changes in your breasts, see your doctor right away. To do the mammogram, you'll stand in front of a machine. The person who takes the X-rays will place your breast between two plastic plates. The plates will press your breast and make it flat. You will have X-rays taken of one breast at a time. It takes only a few seconds to get a breast X-ray. You can get a mammogram at hospitals, clinics, imaging X-ray centers and mobile units. To lawfully perform either screening or diagnostic mammograms, a facility must be certified by the FDA and must display its FDA certificate. If it doesn't, it's a sham operation. Medicare covers screening mammograms for the early detection of breast cancer. You do not need a doctor's order to get a screening mammogram. For women aged 65 and older, Medicare covers one screening mammogram every 2 years. For women who are younger than age 65 and are covered by Medicare, the age and risk of the patient determine how often screening mammograms should be done. Medicare does not cover screenings for women under age 35. Medicare covers diagnostic mammograms when you show any signs of breast disease. If you are on Medicare, diagnostic mammograms are covered when your doctor orders them, no matter what your age. Assuming you have met your Medicare Part B deductible, your out-of-pocket cost should be less than $25. If you have supplemental insurance such as a Medigap policy or Medicaid, you may have no out-of-pocket costs. If you belong to an HMO, the only cost to you is your plan's copayment, which should be $10 or less. An alternative to mammography is thermal imaging/infrared imaging, which finds the heat caused by the increased blood vessels leading to tumors. There are also digital mammograms, ultrasound, and MRIs. A company called Biofield is using electrical patches put on the breast to test for lesions without needing any radiation. For safety's sake, get both a mammogram and another type of test done. There are now possible new tests like a breath test. Mammography websites. ucomparehealthcare.com/mammography_start.html, clinics. healthycommunications.com/mammograms_cause_breast_cancer.htm. mammographysavieslives.org. aneas.net/womenhealth/breast_cancer.asp. careimaging.com/breast-cancer. breastscancertreatment.org. cancer.gov/cancer-topics/pdq/screening/breast/patient. cancer.org. cancerhelp.org.uk/help/default.asp?page $3312. cancernet/cancer-type/breast-cancer.shtml. cdc.gov/cancer/breast/basic_info/screening.htm. dailycampus.com/news/2007/10/new/breast.cancer.test.may.replace.mammograms306265.3.html. fda.gov/cdrh/mammography/certified.html, list of FDA-approved mammography centers by zip code. health.msn.com/centers/breast-cancer. hopkinsbreastcenter.org. imammogram.com. mayoclinic.com/health/mammogram. ndep.nih.gov/resources/silenttrauma.htm. nlm.nih.gov/medlineplus/mammography. self.com/magazine/polls/breast_cancer. stupidevilbastard.com/index/seb/comments/bearing_boobies_breast_cancer_is_back. thebreastcancersite.com. westonaprice.org/women/mammography.html. American Cancer Society. 1599 Clifton Road, NE. Atlanta, Georgia 30329. 800 ACS 2345. 800-227-2345. Cancer.org. Over 3,000 mammography centers in the U.S. are not certified. Call and get a referral about a certified radiology center. Pap smear info. The Pap smear, also called a cervical smear, is named after its developer, George Papanicolaou. In this simple test, some cells and mucus are scraped off the cervix and analyzed in the laboratory for possible abnormalities. If abnormalities are found, the usual follow-up is a biopsy, diagnosis then treatment. Women are advised to have Pap tests at least once a year, especially if they have many sex partners, otherwise, every 2 to 3 years. The general categories of Pap smear findings are: Class I, no abnormal cells. Class II, some unusual cells but probably from a vaginal infection. Class III, atypical cells, further testing. Class IV, cancerous cells. The Pap smear test will pick up abnormal changes in the cervical cells caused by cancer or infections like HPV, the human papillomavirus, which is a wart that has been linked to cervical cancer. You cannot be screened during a menstrual period. The best time to have the test is about 2 weeks after the first day of your period. For the test, the woman lies on her back with her knees apart. The doctor or nurse puts a sterile instrument called a speculum into the vagina to help see the cervix. He or she uses a tiny spatula or a brush to scrape some cells from the cervix. Sometimes the doctor conducts a pelvic examination in the process. With a pelvic exam, the doctor checks the vagina, womb, and ovaries using a gloved hand. hercancer.com, 866 HER-Cancer. nccc-online.org, 800-685-5531, cervical cancer. oncolink.upenn.edu/specialty/gyn-onc/cervical. health.allrefer.com/health/pap-smear-info.html, Pap smear, Papanicolaou test. American Cancer Society. 1599, Clifton Road. N.A. Atlanta, Georgia, 30329. 800 ACS 2345. 800-227-2345. 404-329-5787. Fax, 404-329-5787. Cancer.org. If you have cervical cancer, you may be eligible to be a part of experimental, clinical trials. Call 301-491-1277 for information. American Society for Colposcopy and Cervical Pathology. American College of Obstetrics and Gynecologists. 409 12th Street Southwest. Washington, D.C. 20024. 800-673-8444. 800-468-3637. 202-484-3321. 202-638-5577. acog.org. Provides referrals and offers publications relating to women's issues, i.e., understanding hysterectomy, Pap smear info, etc. Pelvic exam/gynecologic exam/Pap smear. A pelvic exam is an exam of the vagina, cervix, and uterus done by a gynecologist using a speculum. A pelvic exam screens for cancer, sexually transmitted diseases, endometriosis, and other diseases. babiesonline.com/article/pregnancy/pelvic-exam.asp. coolnurse.com/pelvic_exams.htm. dph.sf.ca.us/health-info/std_pelvic.htm, San Francisco Department of Public Health. drgrayobgyn.com. firstvisit.org. gynalternatives.com. gynecologionline.com. healthathos.com/healthathos/a-to-z/nc/pelvic_exam.jsp. healthline.com. healthopedia.com/pelvic-exam/prepare.html. intelihealth.com. kidshealth.org/teen/your_body/medical_care/obgyn.html. mcg.edu/shs/pelvic.htm, the pelvic exam. medinfo.ufl.edu/year1/bcs96/slides/pelvic, slides describing the pelvic exam procedure. obgyn.net. pelvic-exam-procedure.tr47.com. ppcna.org/pelviexam.html, anatomy of a pelvic exam. rex.nci.nih.gov/patients/com_ed_ready/pelvic/pelvic_main.htm. sa.psu.edu/us/women's-health/pelvic-exam.cfm. sacrad.com/exam/pelvic_obgyn_ultrasound.html. sexinfo10one.com/sh_pelvic-exam.shtml. sex-project.com. sogc.org/health/health-exam_e.asp. store.brooksidepress.org/5p16.html, 5-minute pelvic exam video. teenwire.com. thehealthencyclopedia.com/term/pelvic_exam. vaginismuse.com. vul-pain.dircon.co.uk/html/pelvic-floor.htm, Vulval Pain Society. wdxcyber.com. webmd.com/a-to-guide/pelvic-exam-for-exam-for-endometriosis. women.webmd.aol.com/guide/pelvic-examination. women.webmd.com/women-medical-reference/pelvic-examination. womens-health.com/gyn_health/gyn_tst_pelvic.html. youngwomenshealth.org/pelvicinfo.html. yourpelvicexam.com, your online resource for questions about pelvic exams. Chapter 6. Other cancer detection ideas. Dogs can be trained to sniff cancer for early detection. Studies have been done that prove that dogs can be trained to detect cancer, but how would you use this ability? Many people are afraid of dogs. Most people don't care about cancer until they start to feel weak. If you start a business and charge a fee like $50, people feel ripped off if the dog doesn't detect cancer. Local SPCAs should train their dogs and provide the service as a way to make money. Is treatment working? Tests to see how much cancer is in your body. There are tests to determine how much cancer you have. Take sequential tests every few months to see if cancer goes down. If your cancer is getting worse, do something else or more. Take test 1 for a baseline to compare future tests to. The tests are: blood and urine test measures a combination of biomarkers. The Navarro urine test. Infrared thermographs. Barium enema test. Electro-interstitial scanning, EIS. The Navarro urine test is not as accurate as the blood tests. NavarroMedicalClinic.com. Infrared thermographs, i.e. infrared camera scan. Exactly where cancer or tumors are located. FLIR.com. A PET scan is the best, but it does create a lot of radiation. PSA, prostate-specific antigen blood test, aren't that good for men for prostate cancer. Devices to determine how many microbes and where they are in your body. Siemens.com, early detection and prevention. Life Systems. ZYTO, ZYTO.com. Biomeridian, biomeridian.com.